Hi, I'm Pearl, and I want to describe to you biological causes for anxiety disorders. So, anxiety disorder is not quite the same as your anxiety that you will experience on a day-to-day basis. Anxiety disorder has a lot of the same symptoms as that anxiety, but here are some differences. You have your you have your excessive and persistent worry, concern, or caution. You also have restlessness. You also have sleep disturbances and concentration difficulties. So, your excessive and persistent worry, concern, or caution is not the worry or concern that you experience right before your first day of the semester or right before your first final. It's what people experience when you're seeing them in class and they're still shaking their leg on a random Wednesday halfway through the semester. Those people um, are experiencing more of that persistent, excessive concentration difficulties and worry or concern. So then you also have restlessness and sleep disturbances. Your restlessness is those people who struggle falling asleep every single day. Your sleep disturbances is people who struggle staying asleep more than once a day. So these are the people that are waking up multiple times in the middle of the night every night, which is causing them to be tired. Or same thing with falling asleep. They're having trouble falling asleep. That is making them tired. I've also noticed that hypersomnia, which is where people are sleeping too much all the time, which also makes them tired, is also a symptom that was experienced with GAD. So, biological causes. There are many, 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 but here are a couple. We have transmission pathways. We have our GABA and our GABA A receptor. When that is abnormal, that is seen to have caused symptoms of generalized anxiety disorder. We also have hypersensitivity to CCK agonists. CCKB is a G protein coupled receptor. When stimulated, it is also proven to produce anxiety symptoms. We also have genetic contributions, which is a very, very big topic. So we are just going to go over it very generally. There are very many specific genetic issues and chromosomes that, if you would be interested in, you can do research on, but it is very complicated to explain in a presentation. So neurotransmission you must have a neurotransmitter first. So what is a neurotransmitter? It must follow all four of these classifications. It must be a molecule that is produced and released by the same neuron and stored in a post or a presynaptic terminal. So your presynaptic neuron is where it's made. That terminal is where it is transported over to the other one, and then that postsynaptic neuron is where it is relaying the signal to. It must prompt a specific biological effect in the postsynaptic neuron, and it must be able to prompt the same effect whether or not it was exogenous administration or endogenous administration, so whether or not the signal came from outside of the body or inside the body. And it must also have a specific mechanism that can be used to stop the effect. So GABA is an amino acid, and it, when properly working, will be able to decrease the ability that a neuron has to pass the threshold for action potential. So GABA A is the receptor. It is a primary inhibitor, and it is a ligand-gated ion channel. So when your GABA binds to its receptor, the channel will open. Chloride ions, which are pretty negative, will move across the membrane and cause hyperpolarization in the neuron. That will make it harder to initiate depolarization, which is what allows a more regulated amount of anxiety symptoms in a normal, healthy brain. In patients with generalized anxiety disorder, however, we see receptor downregulation. So that is caused by the overstimulation of GABA, and it creates a decreased sensitivity to GABA as well. So that means that it's not going into hyperpolarization, which means it's much easier to depolarize, which makes patients experience their symptoms with less of a stimulus and also experience their symptoms for a longer period of time. Here is a brief picture that I made to help us see and visualize what is happening here. We have our first one, which is the closed ligand-gated ion channel. And then in the second one, we see the neurotransmitter has bonded to its receptor, allowing chloride ions to move through in the direction of the concentration. CCK agonist. So let's start with CCK. CCK is a hormone. It can be gastrointestinal or it can stimulate the central nervous system. So CCK-A is for food intake reduction. We're not going to talk about that one very much. CCK-B is what is inducing anxiety symptoms. So CCK-B receptor is distributed all around the brain and is very populated in the brain, but it is more so populated specifically in the amygdala, which is known for causing anxiety symptoms such as your fight or flight experience, etc. So anxiety symptoms are obviously then best induced by the activation of the CCK-B receptor, which is a G protein coupled receptor. So that is where your CCK-B will bond to the receptor that will cause a conformational change. The G protein coupled receptor will then interact with the G protein, causing GDP to turn into GTP. Your alpha subunit will dissociate from your beta and your gamma, and it will relay the signal to other parts of the neuron. So here you can kind of see a diagram that I made describing this. So in your first one, you have that unactivated G protein coupled receptor. All three subunits are still put together and you have GDP. However, once activated, your alpha subunit dissociates with GTP, leaving your beta and gamma subunit behind. So in terms of agonist, the agonist is a molecule that will mimic a hormone. So it will still activate the receptor. When this happens, you will still experience the symptoms of anxiety despite not having the CCK-B in abundance enough to do that. So CCK agonists are seen in a lot of generalized anxiety disorder patients because the agonist is what is causing another way to cause their experience of a high fluctuation of symptoms. Okay, genetic contributions. So there are two major genetic factors. We have social anxiety disorder and related phobias, most specifically agoraphobia. We also have other phobias, could be a wide variety of different phobias, but specifically social anxiety disorder. There is a genetic heritability of about 31.6%, which is considered statistically significant, which means that it is supporting the idea that it is not a coincidence that the offspring of parents with generalized anxiety disorder also have generalized anxiety disorder. One of the major points is that there is a genetic overlap between generalized anxiety disorder, major depressive disorder, social anxiety disorder, and neuroticism. So neuroticism is not a word that you hear every day. That is for intense anger, sadness, and anxiety. So obviously, a lot of these symptoms overlap, but it is very important that you are able to distinguish between them, or at least recognize that they are distinguishable, because a patient with generalized anxiety disorder may experience major depressive disorder or neuroticism or social anxiety disorder, but they may not, or they may experience a combination of any of those. It's all genetic. It could be anything. But it is very important to recognize that a patient with generalized anxiety disorder will have different experiences than a patient who has generalized anxiety disorder and major depressive disorder. There are a couple key takeaways here. We have our two pathways, which is our GABA A and our GABA A receptor. That's a ligand-gated ion channel, so your neurotransmitter bonds to the receptor and it opens and the chloride ions will move through. You have your CCK, your CCKB receptor. That is a G protein coupled receptor. So your CCK is activating the CCKB receptor, which causes your alpha subunit to dissociate eventually. And it will relay the signal. Your genetic inheritance is about that 32% inheritability, and that overlap between generalized anxiety disorder, social anxiety disorder, um, major depressive disorder, and neuroticism. Thank you.